All I know is I'm here today, I'm healthy, and I use medical cannabis, and I'm thankful.
I achieved complete clinical remission from the cannabis alone, and I would rather be illegally alive than legally dead.
This child needs cannabis.
I'd take a hit and the pain would disappear. It was instant. I mean, instant.
I've always looked at cannabis as being a medicine.
People say you get high. You don't get high, you get medicated.
I'd like to see it so that, people aren't criminalized over something that's medicinal.
It's a God-given plant. We should all be able to use it. It's real medicine.
NPK. The NPK Show. NPK. To all the listeners around the world. You're listening to NPK.
Well, welcome back to another episode of NPK Live. You're with myself, Stephen, and we have a guest of honour today. Liam, how are you?
I'm good, thanks, mate.
Good, thank you very much for joining us. And first of all, apologies for people that listen every week. Last week we were just up the wall. It was roasting, and halfway through the research for this podcast, which is medicinal CBD in the UK, and we'll probably talk about around the world as well. It was so in-depth, I didn't want to give a below-average podcast. So I told everyone on Instagram last week, apologies for no podcast. It will be doing this for you on Sunday. And Liam got in touch, and thank you very much, because there's not many people better placed in the UK to be able to talk about CBD and medicinal CBD in the UK. So thank you very much for joining us. If you're an avid listener of the podcast, you remember... I think we just checked in November 20th, 2016.
Nearly,
you were last on.
About 18 months, 2 years ago.
Yeah. And it's been non-stop for you since then, really, hasn't it?
It's been pretty crazy, mate, to be honest, yeah.
What have you been up to? Where have you been? You've been to a lot of events, haven't you?
Yeah. So at the time, when we did the original podcast, the MHRA had made their announcement about
that was
CBD being classed as a medicine, which I think was in response to GW's initial announcement about Epidiolex.
Yeah.
Funny enough, they've just recently gained approval from the FDA in the US for that. And that looks like it's going to result in the DEA rescheduling CBD to a Schedule 2.
In the US?
Yeah, which is big.
Yeah.
From a global perspective, certainly from the US, in terms of what it means for CBD.
Because they dictate a lot of policies around the world, don't they, when the US does it?
They do,
Other countries start looking at their policies.
But also, it's like the industry there is massive.
Yeah.
Like in terms of this global market, US is huge in comparison to anything else.
Yeah.
But they can't move these products across state lines. They can't play globally, particularly. It's really difficult to. CBD's always been that sort of grey area for them.
Yeah.
But no, it's a big move. It'll be interesting to see the ramifications that it has for CBD as a compound, both as a food and a pharmaceutical.
Yeah.
I think that's what's interesting here.
A couple of events you've been to this year. Europa, you were in CBD. It was in Germany, was it?
So the ICBC in Berlin.
Yeah, in Berlin.
Observed the previous year as well. So that was it was really interesting. The guy, he booked that event 2 years in advance, and he ended up being there that April last year.
Yeah.
Literally the same week that they've released the German regulations.
Yeah.
So it was really, he was like, "This is crazy." It was buzzing. Lots of people there. It's kind of like Germany, superpower of Europe, legalizing cannabis. It's exciting times, and it's been very interesting in the interim, how to see how things have developed. Everyone thought the Germans would have, nailed the legislation, and which they did. Like their regulations are quite open. They've allocated 26 conditions that doctors can prescribe for medical cannabis. But the cultivation license application process was a complete disaster.
Yeah.
They've had court ruling, which is basically putting them back to square one because they try to, some of the smaller companies, they were like, knocking them out for spurious reasons and this and that. So yeah, it's not all smooth. It's not a smooth road, I guess.
Yeah, it's a transition, isn't it? We're all learning, like you said. It's like it's the technology era all over again.
Yeah, so it is. Yeah, so I guess from my perspective, in the last 18 months or since the last podcast, I've been doing a lot of work all around Europe, all around the world, Australia, Canada, US, just, seeing what's going on in the industry, making connections, building a network and building businesses. So like Elite Healthcare Distribution that we talked about it back at the time, that's what we were sort of our starting venture around the CBD business. We're hoping to be a European distributor of medical cannabis products through that business, which is becoming more and more likely. We've got producers that we've got contracts with, and we have partners with licenses that we can distribute through. So that's all starting to come to fruition, which is great. And we've got a really good network, quite well regarded. We have producers from Jamaica, Macedonia, Colombia, Australia, that hold us in high regard, and trust the advice that we're giving them, and they're trusting us to distribute their products in this market, get them access, build their brands. So it's really sort of developing and opening up. And there's lots of other opportunities as well. But the legal situation is still developing.
Yeah. Well, I've been, since the last podcast as well, I've been following you on Instagram, and you've been working non-stop, hard at it. So thank you very much for coming on the podcast and sharing your knowledge.
I appreciate the opportunity as well. Look, in terms of background, which we discussed before, I started in the hydro industry 11 years ago.
Yeah.
Studied marine science, so I got a good science background like yourself. That sort of oceanography, marine science, like so we're going ecosystems, and that really gives you.
We're going to get you in for a plastics podcast. I know it's affecting the oceans one day, shall we?
Yeah, exactly.
We won't go off on that one.
No, let's not go down that rabbit hole. But it's that sort of science background, and those gives you a good feel for these bigger systems. It's a really good base to work from with emerging technologies like this. Compliance testing I did for 6 years with a couple of different companies, and again, that sort of rigorous lab testing, the quality control, European legislation. This is interesting because I started when I graduated university, worked there in 2002. In 2003, the regulations changed from British standards to European standards.
Yeah.
In that, in construction testing, everybody had to change your lab equipment. The whole thing is just whatever was no good was no good. You didn't have any choice. Yeah, you just had to replace all your lab equipment, and now you're working to European standards.
Mad.
That's how it works, and this is why people all around the world have, give us so much credence when we're trying to advise them on how this market works.
Yeah, because you've been there and done it.
Yeah, to a degree, different sectors, but nonetheless, the systems will be the same, and that's where cannabis will be in the future, medical and food. Yeah, and everything else, there will be
standardized.
Very much so. Yeah. The legislation through the EMA, the European Medicines Agency, these organizations will set standards that ultimately will apply across the whole of Europe. So we're in this interim period where it's developing, and we're trying to navigate these waters to get ourselves in an early market position ultimately.
Okay.
But yeah, really, you'll get there. And I was involved in this Cannabis Europa conference down in London, which was a huge success.
I see, that looked good.
Yeah, it was really.
Is it going to be? Is it on next year? Or is it a one-off?
Yeah, so we're as we got involved in that as ECTA, the non-profit educational platform, European Cannabinoid Therapy Association. So we're going to take that and focus more on the educational seminars, and the other partners are going to sort of focus on the political and the business side of things.
Yeah.
So I think they'll undoubtedly be doing something next year, and we'll probably be working with them as well. So
yeah, man, it'd be awesome. I think I'll definitely try and get down to that one this year. It looked very good. This next year, this year's one looked really good.
Yeah, we had a few people there, from the hydro side of things, which was nice.
Yeah,
to see a few faces turn up, to be honest. And they're all from the bigger stores.
Yeah.
Which is really interesting.
So they know what's going on.
More progressive.
Yeah.
But yeah, so 11 years working in the hydro industry for me, and then sort of leading into this, it's really interesting that there aren't that many people seeing the opportunity.
Yeah.
Really.
So you're capturing
it. Well, doing what we can to do so.
Making an impact as well.
It's not an easy road though, There's people in the industry that will know, HID and WHG and all the rest of it. It's not an easy road.
Yeah.
But we're close to really making an impact and bringing some things to fruition. So just to say while I'm here that we appreciate the support of our suppliers that stick with us and the stores that buy from us, because they know that we're good people and we're trying to do the right thing. So
100%.
appreciate that too.
Yeah, man. Well, for anybody that's not too sure or hasn't listened to previous podcasts, we need to explain what is CBD. It stands for cannabidiol. And that's the way I say it. I know.
I would say cannabidiol, but again,
Cannabidiol.
I used to say Sativex, but apparently it's Sativex. So who knows?
So it's tomato a little bit. So CBD stands for cannabidiol or cannabidiol, and it's a component of the larger cannabis plant. It is obviously it's the medicinal side of cannabis, but one of the aspects that we're going to talk about is that CBD is the star player. THC is the most well-known compound because it's the compound that gives you the high. I believe it also has medicinal aspects, but I think they're going to come out later down the line. CBD is the star player in terms of medicinal qualities. But how many? There's about 113 cannabinoids, and we really know two. Really know about two, and probably the people in the know could reel off another 4 or 5 off the top of their heads.
So
there's like hundreds.
For example, common ones or certainly more prevalent cannabinoids would be CBG and cannabidiol. I think I can't remember the name. Sorry, CBG and CBC. So CBG apparently is very similar properties to CBD, but maybe it doesn't have the same complications, which I guess we're going to talk about.
Yeah.
So there are 113 plus cannabinoids. There are hundreds and hundreds of terpenes, which are also influential and important too. And CBD at this point has seems to have a wider range of effect than THC. Important for different reasons.
But what we need to get across in this podcast is that it's about the plant working together. It's about the cannabinoids working together. CBD is very good at maybe doing one thing. It's really poor at doing another thing. So some of the when I'm looking at scientific studies, if I haven't got a lot of time to go and review every single study that I want to look at, I go into Cochrane. Now they're a scientific database that reviews all of the studies and will basically mark it and tell you what's good and what's bad and what studies have done really well. So I picked 3 and it sort of builds up a picture of why science is so critical to the promotion of cannabis, cannabinoids, and we can't look the other way. Some people go, big pharma's getting involved. Big pharma will probably end up paying for a lot of these scientific studies, and they are really important. First case in hand, there's a big write-up on it, but they basically took children with Dravet, Douce and Lennox-Gastaut syndrome, which are all forms of epilepsy. It was a small study, and they used Charlotte's Web oil, otherwise known as, it's sometimes called realm oil. And out of I think they chose 19 children, 100% of them experienced reductions in seizures. Out of those, I think 75% had reductions of 3 months, had no seizures for 3 months, 50% over 6 months had no seizures, and 25% had no seizures for the full year. So these are children where traditional medicines aren't working either. So that's a really good study. And what that has led to is at the end of this, I'm not going to read it all out because it's quite boring, but I can, if anyone's interested in the study, I can give you the links for it. The last 3 sentences, which is what science is all about. We propose that the results of this survey can inform the design of a large, randomized, double-blinded, placebo-controlled efficacy trial to investigate realm oil, Charlotte's Web, as an adjunctive therapy in highly refractory pediatric epilepsies. So in layman's terms, what that means is that this scientific study has shown that CBD oil does work for reducing epilepsy in children. What we now need to see is a larger study, double-blinded, placeboed, and that means that when that study comes out, we can say with high degree of accuracy that CBD really does have a massive effect on children's epilepsy.
Yeah, I think from a trial perspective, certain things are difficult, like chronic pain or pain in general is really hard to study because it's
just on a scale, isn't it? How do you feel?
Objective or subjective?
Subjective, yeah.
So epilepsy, it's something, a fit is something that's tangible and measurable. So it tends to be quite good for that type of,
Yeah, and on kids as well. It's just, it's what a study to come out with, because if there's any benefit from CBD oil you'd want it to be to reducing epilepsy seizures in children. Now, this I've picked up on 3 studies, and they bring together a bigger picture of why we need science. The second study was the effects on Crohn's disease. Now, the study showed that it had a very little effect on Crohn's disease. However, it was a small sample size. They used a low dose of CBD, and they believed that because they just used CBD, there was no synergism with the other cannabinoids. So this research has shown that it doesn't have an effect on Crohn's disease. However, we do know that from other studies that people have experienced reduction in the Crohn's disease. So why didn't we find it with CBD? Is it the other cannabinoids? And this leads to further research and opening up the whole world of the 113 cannabinoids.
The terpenes.
And the terpenes, yeah. I was saying, wasn't it, like aromatherapies in a scientific aspect, aromatherapy is a bit wishy-washy. However, you cannot, like even me, who there's, I'm against all the homeopathy stuff.
Yeah, of course.
But when you've got a headache, a couple of drops of lavender on the pillow, and it just seems to relax you.
Well, it affects different people in different ways. So in the same way that these cannabinoids affect people in different ways, you know, certain oils or aromas, for example, you know, will give a wife a really bad headache.
Yeah.
And even myself, I can't remember what we used one time. And it was just like the two of us are walking around the house, we're just banging headache all day.
Yeah.
There's some cleaner that we'd use. And it was like, it's horrendous.
It's mad. It could be that terpenes have an effect on the body, and they just need a carrier.
This is it. Yeah, we
so
don't.
CBD's could be the carrier.
That's right. Yeah.
So you're really excited about terpenes and the effect on the human body, aren't you? The third study, and this is, if you're going to listen to any part of the podcast, this is the thing to listen to because it's so important, and it's why science is so important in the whole study of CBD and moving forward. So in the third study that I found, they had a big group of people and they were testing CBD again on epilepsy. Now, what they found with one lady who was taking a drug called tacrolimus, which is a transplant drug. Now, CBD on a biological level reacts with certain pathways within the liver and certain enzymes. And as tacrolimus, the CBD was inhibiting the pathways used by that drug. So a body started rejecting the organ that she'd had in the transplant. And they fortunately, they found this really early on in the study. They took her off the CBD and started putting her back on the tacrolimus, and the body again started accepting it.
And this is the thing we before the podcast we were talking about when we did the original podcast back in November 16. That was one of my points at the time, was like CBD isn't this like completely harmless cure all. Like it does have some interactions and complications.
Yeah.
And as you said, as far as like medicine's concerned and pharma companies, yes, there's some activities there. Yeah, activities which could be better, I guess, or could be done better. The trials need to be done. The tests needs to be done. For us as citizens, I have this thing about regulation where people think it's a bad thing, but you just need to engage with regulation. We as citizens in regulation, not just in this sense or in medicines, but food, water, all of this stuff like fuel, all of the stuff that is around us that we consume and use in our lives. Like we don't engage with the regulation. We don't hold people accountable. So if we're actually more engaged with the regulation, we have more influence over it.
Yeah. There's a perfect story. It's a real sad story. It came out last night that a young 3-year-old boy in hospital died because he was given an overdose of his medicine 7 times more than he should have been given. I can't remember off the top of my head. I think he did. He suffered with seizures. Okay. He was 3 years old, and he went into hospital as he had done countless times before. But I don't know the full story. I only read it late last night, but probably because somebody hasn't followed protocol, somebody hasn't followed regulations. He was given 7 times the amount of medicine he should have, and unfortunately, sadly, passed away.
But that would be more to do with management systems and communication between members of staff in a situation. Really, that's unfortunately down to that probably. And
a drug that was there to help him, which would have done at the normal dose, has had very dire consequences in the end. So what I want to get across is that even though everybody in the industry, everybody that is for the cannabis plant, there's still, you've got to sort of take a step back and let sometimes you've got to dance with the devil. These pharmaceutical companies will spend the multiple millions of pounds for this research to be done to find out that because your parent, uncle, auntie, sister, daughter, whoever is on this medication, if she took CBD for her seizures, then it could interact and she'd have far dire consequences because of the interaction. So it's really important that we take a step back and try and be a little less emotional about it all.
Agreed. And I think people have to consider that you're trying to basically merge like this black market really with you know, something, a system which is quite sophisticated. So, you know, like, you have to engage with the regulations and that's what we're trying to do in trying to build these businesses is find a way to apply it and to get it into the market. Like, you know, and as far as like prescription of these products, we'll talk about global markets later. You know, you go to Germany, you go to like Czech Republic is a bit of a disaster for medical cannabis. There's no doctors really prescribing there. It's really hard for patients to get access to prescriptions. So there are other issues like we'll talk about UK and like it's what's happening is positive right now.
Yeah.
But there's a long way to go.
Yeah.
You know?
And somebody said as well on one of our Instagram posts, education of the doctors as well. They've been trained up in a certain way. Yeah. It's going to take a lot for them to retrain themselves.
Well, they're the gateway. They're the gatekeeper ultimately in this whole process. No one is engaging with them.
No, we need to.
No one.
Yeah, we need to start.
Very few people are
thinking about it.
Yep.
So moving on from the science, we've got the next part is how are people using it? It's edibles. People put into cakes.
Yeah. So I think most of the market at this point, as far as CBD products in the UK, are tincture oils that people are dropping under the tongue. I think that's by far and away the largest part of the market. You're getting more topical products now, creams and ointments. Some people doing edibles. I think it's quite a small part of the market.
Yeah.
I think there's probably a fair few vapes people doing vape oils and things, but definitely tincture oils are the biggest part of it. I think it's relatively easy to make. They're cheaper to make. People feel like it's more of a medicine. You know, if you like older generations, are they going to be vaping? They're probably more resistant to that stuff. Eating gummies just feels weird.
Unless you ganja granny, you're not vaping your medicines.
Exactly. So but like more sophisticated application forms are required. But again, you know, that's costs money, takes time to research.
Yeah.
You can add, you know, nanotechnology to increase bioavailability.
Yeah.
The sophistication with this will grow over time.
Yeah,
that's for sure.
Here's a question that I'm going to throw at you. A lot of people will be against synthetic ways of making CBD.
Yeah.
If the pharmaceutical company finds a way of creating a compound that does the same thing as CBD without the use of the plant, I think there's going to be a lot of people against it. For even just myself, as somebody who can look objectively at the science, I'd be against something being created in a lab. But I also know that paracetamol is a naturally occurring substance.
Yeah.
And we've just sort of, I don't like using this word for medicine, but we've weaponized paracetamol so that we get the same time and time again.
Modified
it's safe and modified it.
So I suppose two different, nothing exists on this earth that hasn't come from something on this earth.
Yeah.
Whether it's seen to be natural or organic, it's all come from somewhere.
Yeah.
That's one perspective on it, I guess. For me, I guess, well, the way I really think about it is there's a big disruption coming for the pharmaceutical industry and the medicine in general, because the way they do things is like, here's a compound, we isolate that compound, we can apply it to this, and like, does it have this effect? Yes. Light comes on, great.
Yeah.
Can we make it safely, consistently? Yes. Is it killing anybody? No. Is it giving people the runs? Yeah, but it's like livable.
Yeah.
So then we patent it. We get 10 years exclusivity, and we get to charge the taxpayer a fortune. Frankly, we don't really consider it, but like all this money that the pharmaceutical companies are making, generally in our part of the world, where we have these national healthcare systems, that money's coming out of our pocket.
Yeah,
as taxpayers.
Yeah.
So if you think about it in those terms, and you go, well, so how do they do the trials? Well, really, the maximum number of people they trial on is probably about 2,000, 3,000 people when they get to stage 4 trial. It's not really a huge number of people, particularly. No. So when you look at these natural compounds, cannabis has kind of like opened the door into this like other world of medicine where unlicensed medicines is actually a sector that exists where you don't need to do a clinical trial. And if a compound or a product is seen to have medical benefit, it can be made available as an unlicensed medicine. A product with a marketing authorization will take priority as far as prescriptions are concerned. But something that's unlicensed could potentially be prescribed. So with CBD, for example, there isn't a marketing authorized product in the market at the moment. So if someone was to make an unlicensed product available, doctors could prescribe it. You have to go through the health authority. You have to go through the Home Office because it carries a small amount of THC.
Yeah.
So the Home Office go, we feel it's a safe amount of THC. Then the MHRA say, okay, it's manufactured to the right safety level, etc. is consistent. We're going to allow you to put that on, make it available. And then you can let doctors know it's available, but you can't advertise the product.
Yeah.
So that system exists.
Yeah.
If you think about it in that context, what does it cost to bring that product to market in comparison to a marketing authorization? It's not safe.
Yeah.
CBD is relatively harmless.
Yeah.
With ongoing studies, you can
relatively harmless for a healthy individual.
Exactly. Yeah. So relatively in comparison to some of these compounds.
Yeah.
So as long as you have the safety trials ongoing and you monitor people, the doctors monitoring patients that are taking this stuff, it costs a lot less to bring that to market. And then if you take digital technology, you look at like, if you said 10 years ago that I could fly to Berlin tonight and rent somebody's back bedroom for 25 quid.
Yeah.
Like, what?
From your phone.
Yeah. It's mental.
Yeah.
Right. But it's like these systems have unlocked all this other stuff. There's all the potential in the market. So if you take an app where you can integrate with patients on a daily basis and collect data every 4 times a day.
Yeah.
Whether it's pain relief, whether it's their inflammation, mobility, whatever it happens to be, you can collect that data. So you take that to 1 million people for a CBD trial on, I don't know, back
Alzheimer's,
pain,
back pain,
whatever it happens to be. And you all of a sudden you got a trial, not 2,000 people, with 1 million people.
Yeah.
With a lot of data.
And the statistical relevance of all that.
Exactly.
Yeah.
So the cost is much lower to bring to market. The safety profile could be similar. So I think there's a huge, that to me is like a massive disruption that's coming down the track. Now, obviously, companies that benefit from the existing system will resist that, understandably. But, taxi companies resisted Uber.
Yeah.
Uber's still doing okay.
That. The market that dictates who wins.
Yeah.
It doesn't matter if you've got £1 billion in your pocket or $7 in your pocket. Whoever's got the best product, and it doesn't matter who you are as a person, the best product, the market decides, the people decide.
It's a system. It's a flow of energy. Yeah, we're consuming things. We're consuming and spending our money. It's flow of energy.
Yeah.
So whichever is the most efficient and effective system, the energy will flow through that channel.
Yeah.
So which channel is it going to be?
I think as well that the big stumbling block for pharmaceutical companies is that synergism, the synergism of the cannabis plant. 113 compounds. Now, I'm not going to do the quick maths to figure it out. I don't even know if a calculator could figure it out. But the combinations from, the first 2 cannabinoids, and then the first cannabinoid with the third, the first with the fourth, and then the second with the third. There's trillions of combinations.
Plus 300 terpenes.
Yeah. So I can't see it would take just a stupid amount of time, well beyond our lifetime, to be able to figure out how to produce it synthetically and all the different ratios.
Yep.
Whereas the cannabis plant, the ratios, we just need to figure out what plant, what genetics, how to grow it, and how to produce it, which is a good thing. It's a positive thing for people who want to believe that their medicine's coming directly from the plant.
Like, it means that there's a lot of growth in the industry too. We have to accept that we don't know everything.
Yeah.
And we should, as a species, we should accept that we don't know everything.
Yeah.
Just continue to learn. So there's a lot of growth, a lot of potential, but a lot of risk as well with this, But I think it gives people hope that there's new things to be found for treating conditions, that are untreatable at the moment. So
I love the Dar O'Brien sketch when he's on stage and people go, science just thinks it knows everything. And he comes back and says, no, science knows it doesn't know everything. If it did, it would stop.
Yeah,
Do you know what I mean?
Well, I don't know. I feel like there is an element of science that it has a snobbery to it.
Yeah.
You know, which I don't like.
Yeah.
That take like, you know, global warming or climate change is something that, being an oceanographer, I feel like I know something about.
Yeah.
And I've read, you know, literature that's contrary to the main narrative, shall we say.
Yeah.
And when you think in the context of the size of the planet, how deep the oceans are, how much water there is on this planet, how much of the land that we actually exist on, and how much, you know, you just got to be open-minded.
Yeah.
And then you think in context,
we know more about space.
Context of our solar system and our galaxy, and we have no idea.
Yeah.
Like literally we don't know. So just be open-minded.
Yeah, because we're fucking small.
Yeah, we really are.
So to get into the CBD in the UK, the reason we're doing this podcast is because there's just been an explosion of legality. The medicinal effects of CBD have really been out in the media recently. It's constantly in the papers. It's been talked about in government. And I would say, you may disagree or agree, that the big turning point was the Billy Caldwell case. That's when everyone seemed to start opening their eyes and going, what's this? What's everyone talking about?
So there's two, I mean, just for global context, so up until 3 years ago, I think there was only really like Uruguay, some of the US states and Canada that had legislation. You know, when you look at it now, there, I don't know how many countries there are globally now. It's over 50. You know, like that's outside the US.
Yeah.
So many countries, like in the last 3 years, it's literally an explosion.
Yeah.
So that just puts a global context on it. As far as the UK is concerned, you got two main stories. So Charlotte and Billy's one. Then you have the Dingley, Alfie Dingley situation as well. So two approaches, I guess. I've known Charlotte since about January time.
Yeah.
Did a bit of work with her. Because she's built a campaign around patient stories. She travelled all over the UK. She was lobbying politicians in Scotland, Wales, Northern Ireland, and in London. So she was kind of going down the political pathway as well. The Dingleys had a separate campaign behind them.
Yeah.
So there's two different approaches, I guess. With Charlotte's situation, Billy had a prescription that was approved by the Health Authority in Northern Ireland is what seems to be the case.
Yeah.
I think it's because someone else approached the health department or the Home Office looking for a similar prescription. They realised that this had slipped through the net and
rescinded the license.
it. Yeah. It wasn't a license. The doctor wrote a prescription. They approved the product.
Yeah.
There was no license involved.
Yeah.
So it really slipped through the net. Yeah. And then that's sort of where it's gone from there. The prescription is running out. She had to do something, as you would do like I got two young kids. Do whatever you need to do.
I'll do 100 years in jail to get them the medicine.
Right. So I think it was probably played well from a media perspective. They announced that she was going to go there. She was going to bring the medicine back. They put the government in a position where they had to make a decision.
Mm-hmm.
If they let her come through with the medicine,
it just opens the floodgates.
Yeah. But obviously then it's not cheap to travel to Canada to get medicine and bring it back, nonetheless. And then obviously when they confiscated the medicine, it sort of evolved from there.
It was uproar, wasn't it?
Yeah, and look, it was somewhat, not circus is a strong word, it was very full on.
Yeah.
You know, and I think, look, they got the right decision in the end. They've said they're going to review it, which they're doing, following that process that every other country that's legalized has gone through.
Yeah.
I think at that point, they probably should have pulled back a bit.
Yeah.
I think they sort of kept going, and that's has created some resistance in the way they formed the panel.
Yeah.
And in, you know, the difficulties they've had when they went back to Northern Ireland in terms of getting the medicine.
They've had to get it done all over again for Northern Ireland, haven't they?
So, you know, this is the interesting thing. Like I talk about engagement with regulation, doing things a certain way. You know, you have to work. If you want these changes, you have to do them a certain way. You want to get it across the line.
Yeah.
So, and you know, they did that up to a point, and then they kind of went too far. Dingley's on the other hand, they've, you know, had a meeting with the Prime Minister. Now they've got their license to go on to Holland. She's just come back with the medicine, having a slightly easier time. They went around a slightly different way.
Yeah.
Going forward, in terms of how they set up the legislation, I think it'd be interesting to see how that plays out.
Yeah.
So in terms of the global markets, then when you look at like Germany, for example, we everyone was of the opinion that they'd like reclassified cannabis because the Schedule 1 raw cannabis, flower and oil and resin is considered Schedule 1 most of the world.
It's Schedule 1 means no medicinal value whatsoever.
Yeah, that's right. Harmful and no medicinal value. So one of the partners in the conference, Hanway Associates, Henry Fisher, doctor that works with, and he's one of the partners there. He'd been doing some research into the German legislation and realized that they didn't actually reschedule it. They created a new category of product in Schedule 3 in Germany.
Yeah.
So it's like, okay. I was kind of like, oh, that seems really difficult. And I was like, that's really easy.
Yeah.
If you're just going to write a new schedule, just create a new category of product, that seems really straightforward. So I started thinking about, well, what did they do with Sativex?
Yeah.
Then I started like, on the computer, I was like, it's all there. They just basically, they do this thing called a statutory instrument where they just like the Home Secretary suggests this change to the legislation, a new category of product, gets advice from the Medical Advisory Council. If they support it, it goes in front of the House. Nobody objects. In 30 to 40 days, it's law.
Yeah.
And that's what happened with Sativex.
How come it's so easy for them? How come it was so easy?
Yeah, but because they had the marketing authorization.
And they knew what to do.
Well, they had a marketing authorization.
Yeah.
So they'd gone through all those channels. They spent a lot of money, all that kind of stuff.
Yeah.
So then it was a much easier case for the Home Secretary at the time to say, we should support this and create a new category of product. And when you look at Schedule 4 Part 1, that's basically it's a description of Sativex without naming the product.
Yeah.
But it means that someone else could create a product of a similar nature to treat a different condition and it would fit in that category. Do you know what I mean? So it has like that door is open, so to speak, for other people.
You just need to know how to open it.
So what would be effective now is if they created a new category of products for Schedule 4 Part 1, which was based around unlicensed cannabis medicines. That would be the quickest and easiest way to do it. Whether they'll do that is a whole other story.
Why do we always seem in the UK to do things the difficult way?
I don't know. Well, look, it's not necessarily just here, to be honest with you. It's the same everywhere else. Like in Germany, as I said, they've had real problems with the legislation on two fronts. So they created really open, like in terms of the access to prescriptions. You can go and see your doctor, you can get a prescription. The main problem they had was the insurance company. So we have the NHS, products are approved by the MHRA, then you apply it, and generally the NHS cover it.
Yeah.
As long as it's, there's a fair value process, I think, to go through.
Yeah.
From a German perspective, they have national health insurance through private companies. So like there are 4 or 5 companies that provide all the backing to it, and they were really resistant. Now, there were cases where people were getting prescribed 10 grams a day, and it was 23 euros a gram.
Yeah.
So for an insurance company to go with 230 euros a day, I don't think so, Paul.
Yeah.
And again, this is where these people aren't really thinking. As an industry, we need to jump on that stuff and say, let's pull it back.
Yeah.
Let's make sure these
less emotionally.
Yeah. Well, let's make sure these things don't happen. Yeah. So we're not causing these problems aren't roadblocks.
Yeah.
Because that slows things down for another 6 months. And all the insurance companies, they all talk to each other now. They're on hot on it then and reviewing everything.
How can we stop this? And if they wanted to stop it, they've got them more time. They've got 6 months of grace to think of new ways to slow it down. And if it's not ultimately what they want, because it costs them so much.
There is an element of that. There's only so much you can do in that respect. But I just think you have to try and think about how is this thing structured? How is the legislation structured? How do we make sure that doctors are prescribing the right amount, that, patients are proactive in engaging with their doctors in the right way? There are things that we can put in place to try and make sure that happens. So that at some point, when it does come into place in the UK, it could be 6 months, it could be 18 months, depends on what process they follow and how long it takes to enact this. You know?
Do you think public perception's in the right place now? Do you think with the education of it, do you think enough of the UK public have seen the Billy Colroy cases, the Alfie Dingley cases, the Charlotte's Web in the US. Charlotte's Web was sort of like, would you agree, it's sort of like our Alfie Dingley, our Billy Caldwell.
Yes.
A child, it's very emotionally.
I think the thing for me is the public opinion has probably been there for a while.
Yeah.
To be honest with you. Politically, as far as I'm aware, most of the politicians have no issue with it whatsoever. It's just this sort of lack of understanding between the political system and the feelings of the population, where they're just really worried.
Yeah.
And these media cases highlight the support.
Yeah.
That is within them. So yeah, it has had that effect.
Yeah. So one of the things we're next going to talk about is there's a lot of talk about medicinal legalization. Is this happening soon? In your opinion, so what I've written down is that the government's chief medical officer, Dame Sally Davies, gave the green light to an in-depth review. So there's the primary review, and then she's given the green light to a secondary review, which is big because it means more evidence, and the chief doctor for the UK is now behind it, which is a big victory for the campaigners. So this is now the second stage review that's underway now. In your opinion, what would you say medicinal legalization? How far away is it?
Oh, again, it's impossible. It could be 6 months or 18 months.
Yeah.
If they did the statutory instrument, if they use that mechanism, that would take 3 months to do. If they go for a bill, it could be anywhere from 12 months to 2 years.
Yeah.
You look at the situation in Ireland where the bill that was January 17.
Yeah.
And it's like, it ain't going nowhere.
It's just stuck.
But when you read the bill itself, some of the clauses that they tried to, like, there was a clause in there that suggest if they'd physically signed that bill, would have made cannabis completely legal.
Completely legal.
Yeah. Like, why are you putting that in a medical cannabis bill?
Yeah.
Trying to remove it from the
misuse. Was that the one clause? I remember reading or watching. There was one clause that sort of scuppered the whole bill. Was it that one clause?
Probably.
Yeah. I bet you there's loads of people. Damn! Nearly had it in there.
Well, some people would have thought that, but there's a whole load of patients out there that are suffering.
Yeah.
And have done for a further 18 months when they didn't need to.
Yeah.
Because some people wanted to be able to smoke weed.
Yeah. Yeah. And at the end of the day,
which is pretty callous. Like.
Yeah, it is. Yeah. And no matter how much in the states, in the countries in the states where it's legal and you're allowed to smoke, it's great. But the whole point of this, the whole reason people, and I hope it's the whole reason people are passionate about the plant, is because of its medicinal impact on, and more specifically, a child of 3 years old to a 1 year old who's having 20 seizures a day can then have 1-2 seizures a day or no seizures a day. Yeah. If that's all that cannabis did, it's still worth it's worth all this fighting for. But it does so much more. So recreational, yeah, brilliant. It'd be lovely if that happened. But yeah, 100%. It's not expensive.
Like, it's a way down the line. I think being so into the industry at this point, you know, got a lot of connections in Canada and the US, whatever else. I think the big thing there in Canada is, you know, the people realize that the sky doesn't fall in. You know, when you pass the regulation, and then it's like, you know, people aren't walking around stoned all the time. Yeah, there aren't loads of, you know, kids aren't smoking more weed, all the kind of stuff. That medical legislation does not have that effect. Yeah. And it's going to be really interesting to see when recreational legislation comes into play in Canada, how that kind of manifests itself and the response. Yeah. When society kind of goes, well, there isn't really any change because
it's actually decreased.
Anybody that wants to access cannabis can do. Frankly, so you know that, like, there aren't necessarily lots more people accessing.
It's cool now to smoke weed. It's a cool thing.
It's not even
because it's illegal. So as soon as it becomes legal, like
there's
drinking,
no danger to it.
Yeah, it's like, what's the next cool thing we can do?
Maybe, but I think that the other side of it as well is, you look at the US market, 75% of it is non-flower edibles, vapes, concentrates. Worry the hell out of me. I said, where is that going to be in 10 years' time? What are people doing to themselves? It's really, really weird. But nonetheless, 75% of the market is non-flower based in the US. So, you know, it's like more discreet products.
Yeah.
So it's not like it's going to be all in your face, you know, like that's what I think we're going to see play out in Canada.
Yeah.
And it'll, you know, and as I said before, that recreational has already been debated in the House of Parliament in Germany.
Yeah.
You know, like they're aware of social and the economical implications of this. And, those countries like Greece and Macedonia, they're all looking at this as a huge economical opportunity. They want to do recreational as soon as possible.
Yeah. Wouldn't it be it'd be a bastard if we left Europe and then Europe went, okay, yeah, we're all going to pretty much legalise medicinally, we're going to slowly implement recreation, and everyone in the UK is like, fuck. But can we have a revote, please? Nobody's got a problem with a revote now. We want to be back with you Europe.
No, but I think being independent in that respect isn't necessarily, it might necessarily all be bad. I don't know. Like, as long as you have good regulations, my only concern about being outside Europe is Europe implements these really strong systems and regulations for production of things that we consume and we use. Like this, this red tape that people complain about that's like saving your life.
Yeah.
Because like Flint, Michigan, where basically the car manufacturers in Flint, Michigan, were forced to use the river water, okay, because they needed the clean water for the people. So what they did was they were used to wash the cars coming off the line with the river water. They started taking the paint off the cars. So they basically lobbied the government. The government started letting them using the clean water. And where was the river water going?
To the people drinking it?
Yeah.
Oh, fuck.
So we don't want to be part of a system that helps protect against it.
Yeah.
People think this all like, take our country back. Well, you better be ready to fight for it, because there's a lot worse in this country that when they have control of it on their own, they'll do whatever they want. That's what I feel about it. But nonetheless, as long as we're prepared, as long as people are prepared to engage, with the regulations and what's actually happening, then you got to protect yourselves as citizens.
I've put down what would legal CBD mean for the UK, but we've pretty much covered it.
Well, it is just on that. So there is a company that have applied for novel food classification. Okay, so novel food regulation is anything that is not commonplace prior to 1997. You can apply for as a novel food. Company have done so. How long it will take for a judgment on that, we don't know. What happens is the EU body will present a report which will lay out some safety standards. Okay, so like daily consumption, strength of the product, that kind of stuff, and then it will have to be made to GMP food standard, and it will clearly define like clear definition between legal food supplements, as CBD below a certain strength, and then like medicinal CBD products.
Yeah, GMP is the good manufacturing process. Government, basically government walk around and say, yeah, you're doing everything that you said you were going to do. And for the easiest way to describe it is sports supplements or multivitamins. There's some that follow GMP, that when it says it's got 100 milligrams of vitamin C, it has. Other companies that don't follow GMP can probably get away with not putting it in. So GMP is a very good thing.
It is, yeah, absolutely. So that will be implemented at some point, and that will sort of clear up this legal grey area. Okay, it'll probably set some standards around that's 0.2% THC, which technically isn't even a law.
Yeah.
Like the only amount of THC that's allowed in anything is absolutely zero.
Yeah.
As far as the home office are concerned.
Okay.
So that would be good. It would, really set some parameters in the market for companies to be able to actually make products to a standard and have, be able to play in a secure market going forward. So hopefully that'll come out soon. We're not really sure when the EU are going to say produce a report.
The EU's got a lot on the plate at the moment.
A little bit, yeah. There's a few things going on.
Yeah.
So, but that is important
100%.
in terms of like products going. A lot of the product in the market is not GMP standard.
Yeah.
And there are, I think, differences between GMP food and GMP pharma standards. For example, slight differences in cleanliness and security, whatever else. But nonetheless, hopefully that happens soon, and then like consumers can have confidence that products are made to their,
and they're getting the same
consistent.
Consistency. Now, on sort of CBD, and you mentioned the ratio, the amount of THC in a product. The thing that I want to shout out and get people to realize is that there's a big difference between hemp seed oil and CBD.
Yeah,
hemp seed oil is a nutrient. It's a very healthy nutrient. Use it for cooking.
It's an extracted oil.
Yeah.
They're just different.
Like olive oil.
Extracted oils from different parts of the plant can contain different range of compounds. If you're extracting the oils from the flowers, then like that's where the plant produces all the cannabinoids and terpenes.
Yeah.
Because that's the plant's goods, you know, that's what it's protecting.
Yeah.
The cannabinoids and terpenes are environmental responses. So that's they exude them to either attract pests deter pests or attract predators, or, you know, all, sunscreen, all that kind of stuff. That's where they're producing those compounds, producing them on the flowers, and that's why the flowers are more valuable for extraction.
Yeah.
And so hemp seed oil may have some CBD in it. It doesn't. CBD is CBD, I guess. It doesn't matter whether you extract it from the seed of the flower, but the flower-based oil has a lot more of those other compounds in it that are, you know, potentially beneficial.
Yeah. So I just want to make sure people aren't going out and thinking that they're buying a Holland & Barrett CBD oil and they can use it, and all these tests that have been going on that we mentioned earlier in the podcast. You go to Holland & Barrett's and you buy the CBD oil that was used in this test. It wasn't. It's hemp oil, and it's different from CBD. It's oil pressed from a flower is CBD oil. Oil pressed from a seed is hemp seed oil, and it is very, very different.
Just different in the constituent parts.
Yeah.
And the type of effect that you're looking for when you buy that type of product, or those are the compounds that you want.
Yeah,
really,
100%. Hopefully, within 2 years maximum, we get legality of medicinal CBD.
Oh, sorry, medicinal CBD is already legal here.
Yeah.
Okay. So because the government, the MHRA, have said that cannabidiol should be classed as a medicine, then they've already acknowledged that it has a pharmacological effect.
Yeah.
Okay, so that's medicinal CBD is technically legal.
Yeah.
Just no one has produced a product yet.
Yeah.
That they have
accepted.
Yeah, because you can't do it without any THC. If you do it with zero THC, it'd be relatively easy.
Yeah.
THC based products, that's where we need additional legislation, because that's a scheduled substance,
and it's definitely got medicinal effects. There's been very few really well conducted studies on THC, but one of the biggest things that we see observationally is its effect on PTSD, and it has a very positive impact on reducing PTSD. Soldiers returning home, we've got a lot of it obviously in the US and the UK after the war in Afghanistan and Iraq.
Very much
so there's a lot of research potential there, and I always forget the word, but it's a low quality scientific studies have been done on THC, and they do show positive effects. So I'm hoping that CBD so the amount of products available to people in terms of CBD becomes vast, and then that leads on to further THC studies, and we can start really implementing all the aspects of the plant.
So I think, you're a science guy. If you're interested, the International Association of Cannabinoid Medicines, they hold a conference every 2 years. They had one in Cologne last year in September, which I was at. They have they've pretty much every study that's been done since the 70s on THC is available through their website.
Yeah.
Okay, so you can go on there and check it. There's because I was looking at it from a product perspective, if we're, as a distribution company, we're looking to sell these products, we want producers to make us products for treating certain conditions, which I think is where the opportunity is for the next couple of years. And so I think there's a lot for, obviously, chemotherapy and nausea. There's a lot for spinal cord pain. When you look at the Danish legislation, that's where they've put in, they chose 4 conditions. I think it was epilepsy, MS, spinal cord pain, and chemotherapy, nausea.
Yeah.
So that's reflective of where most of the studies are. But all that information is available there. You can see that all the different studies that have been done.
And what was that website again, just for people on the computers trying to get new tabs up?
Yeah, IACM, International Association of Cannabinoid Medicines. If you Google that,
you'll be able to
find
get
it. Yeah, and that's leading European. It's global, international. Sorry.
Yeah. So
but it's a very medical-led organization. Lots of leading doctors, researchers, very scientific focus, and so all the studies are on there, and a good organization to follow.
Good. To move on to future and recreational. There's certain states in the US that are fully recreational, doing well, building. Taxes are up, houses are up, schools are up. everything seems to be doing well with the recreation because it can be taxed and it's a source of income now.
Yeah.
So, in your opinion, how far do you think we could potentially be from recreational in the UK, if ever?
UK is hard to know. Like I feel like it's inevitable eventually.
Yeah.
Canada's a big, because it's the first G7 country to do it. The US, it's a real shame actually, because I think the problem with the US is that the regulations are so poor. Like it's like for medical as well.
Yeah,
You know,
legally.
pesticides, all the, there's no like we're talking about GMP food standards. If those products are made here, they'll be made because you're consuming them to GMP food standards.
Yeah.
Okay, there's nothing like that in the US for this industry.
Yeah. Did you see though I don't know if it was the TLC dispensary or maybe Los Angeles or California. They've now, a lot of dispensaries have had to get rid of a lot of cannabis because these laws have come in.
Something about just like $200 million worth of product destroyed.
Because it's got
California.
It's got pesticide residue on it. It's got heavy metals. Whatever it's got on it wasn't fit for consumption in the medical stuff.
This is it. So that regulation is a good thing. It's got to engage with it. But if it does happen in Europe, then we will have all of that in place. As I said, Greece, from what we understand, they're desperate to do this. Germany have already discussed. Like, it's a big for the German Parliament to have that discussion in their House of Parliament is a big thing. So I think within 2 to 3 years in Europe, I think you're going to have several countries doing it. I think Italy's another. Any of those countries where, like Spain, they have their clubs and everything.
Yeah.
Like, it's already there.
Yeah.
The
structures
and they have
infrastructure.
Their economies are getting a kicking.
Yeah.
So it's a really not easy, but it's a way for them to boost their economies too, and to secure a position in what is going to be a huge market that's going to expand for 30 years easy.
I always say the UK is behind, but hopefully what will happen is the UK will look at what's happened in the US, in Canada, around the world, look at building those regulations so that every patient's safe that needs the medicine, and sort of leapfrog right in to the front.
The key is to view it as a technology and not just as a commodity. Yeah. So all these different compounds that the plant contains that have all these different applications and its physical capabilities as well. If the UK wants to really lead this, and as I said, you got a 30-year market that's going to be as big as the tech industry. Well, the US basically won that race. By a long stretch. They continue to do so because they have the money behind them now. If we're going to do this, then we need to be progressive. Business partner of mine has set up a Oxford Cannabinoid Technologies in conjunction with Oxford University, really to study compounds, their impacts, maybe develop new and novel compounds. That's the kind of thing we need. It's like innovation, developing the technology. That's really, if we're going to lead this race, then that's the only way to do it at this point. Like the Canadians are piling loads of money into buying infrastructure and everything else. Like, it's just farming. In 5 years' time, when you got the mountains in Colombia where it's like perfect for this stuff. Macedonia, like I don't know if you've ever been there, but it's dry as a bone. And it's sun, like most of, like their whole like economy is agriculture, tobacco, grapes. They're shipping wine all over the shop. So these places are ideal for producing on a large scale. The consistency of growing it is another thing, but I think when you move to that scale and you're extracting everything to make things, then it's just farming. So I'm not concerned about like actually physically growing this stuff. I'm thinking more about the technologies. How do we develop these technologies? Initially medicines, then into foods and recreational experiences. And optimizing our life, really. Like certain times of the year where you're not getting as much sunshine, terpenes are a replacement for that stuff. Like how do you give yourself a little lift?
That little lift without having those sad lights in your room all over the place.
All that kind of stuff. So that's where I see it expanding, and then it's into other industries. But technology is the key. Like viewing it as a technology is the key.
Cool. That has been a phenomenal podcast. Liam, what's a good email if anybody was interested, and rather than being the man in the middle, what's a good email or way to contact you if they've got ideas or they want to speak more to you about it? How do they get in contact with you?
So you can get in touch with me. My email is liam@elitehealthcaredistribution.com. bit of a mouthful.
That's all right.
But you can, the website, elitehealthcaredistribution.com.
Yeah.
I'm on Instagram as SNoFarmman.
Yeah.
I'm on Facebook, whatever, Liam McGreevy.
Yeah, follow and watch the hard work he's doing and repping it for the UK. So take me out of to you. Thank you very much.
Thank you, pal.
Pleasure.
Appreciate
Thank you
it.
for coming on the podcast, helping me with the CBD episode. And we'll probably talk again, hopefully, hopefully soon, but hopefully in a couple of years, and we'll be talking about all these products that are available for medicinal uses.
Yeah, exactly.
And the future timescale for THC and all the recreational stuff to come with it. For everyone listening, thank you as always for listening to the podcast. On Sunday we released episode, what was it now? 3, the quality of water for the YouTube show. Go and check that out. A bit more hydro related than today's podcast, but I know a lot of you are really excited about the politics, the laws, the science behind medicinal CBD in the UK. And if you want to get in touch with me, just follow me on Instagram at NPK_hydroponics. Have a great Sunday if you're listening on Sunday. Have a great day if you're listening, whenever you're listening. See you all soon. Take care. Bye-bye.
Them system is a strain and a mess. Me feel it like a pain in my chest. The people need a rest. I feel like me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me can't breathe. When the youth can't write and can't read. Many can't spell, but that them a boy under. You can't tell the man different from woman. Yeah, the people them a swell. The food I give we cancer. Look how long we a tell them about the benefits of ganja. Them no like the smell, so we no get no sponsor. Rum and cigarette company, them running rampant. No money no flow. The ghetto get so stagnant. You have it strong like junior gang flag man. Me say me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me feel claustrophobic. Up in a system where no economic growth is. Me say me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me can't breathe. When the youth can't write and can't read. In the depths of this mental pollution, them want we take a dive. Living in destitution, but still we have survived. In spite of persecution, we humble as a child. Because this revolution is of a different kind. We have a different mind, agree some different signs. Living in a different time. I can feel the frequencies changing around me. It's like the anxiety a drown me. Me say me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me feel claustrophobic. Up in a system where no economic growth is. Me say me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me can't breathe. When the youths can't write and can't read. A long time the Rasta man I want them fill out the bloody meat and go take it to the farm them. Now I just disease them I put in a the can and the damn soya bean. Tumor start farm and the youth them at the future yet the police I remand them. Tell Queen Elizabeth give you what we demand. A repatriation chant to the motherland. Yes we gone then. We know our resort we go harm them cause we can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me feel claustrophobic. Up in a system where no economic growth is. Me say me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me can't breathe. When the youths can't write and can't read. Whoa, no. Skibbly bang, the Rasta man is chanting now. Aye, deny a bingy of his sound. Babylon is burning down, yeah. A King Selassie, I wear the crown. Whoa, no. Feel like me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me feel claustrophobic. Up in a system where no economic growth is. Me say me can't breathe. In a this a suffocation. The people living in a sufferation. Me can't breathe. Me can't breathe. When the youth can't write and can't read.